各位观众，大家好，欢迎收看港湾 TV 今天是7月30号，礼拜四，我们为大家现场带来 BC 省新冠疫情的最新通报。好，开始。那么今天是礼拜四啊。
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Thursday, July the 30th. We're honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Friday, July 31st, we'll be providing a statement with case counts and other relevant information at around 3 o'clock tomorrow. Our next briefing will be next Tuesday after the Canada Day weekend.
因为下周一是这个 BC Day。他又说错了，人家提醒他 BC Day
weekend. I'm almost right. I'm almost right.
他说我老是搞错了啊
，BC next week in fact.
他说我总是对的。
So our next briefing after this will be next Tuesday.
所以下星期二
we'll be doing briefings in person next Tuesday and next Thursday of next week with written briefings
下周二、下周四
and on Friday. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So today for our update, we have 29 new cases to report, bringing the total number of people with COVID-19 in BC to 3,591. That includes 1,076 people in the Vancouver Coastal Health Region, 1,865 people in the Fraser Health Region, 143 people in the Vancouver Island Health Region, 360 people in Interior Health, 86 people in the Northern Health Region, and 61 are people who reside outside of Canada. We have 242 active cases today. Of those, 5 are in hospital and 2 of whom are in critical care or ICU. We have no new deaths to report today.
没有啊，没有新增死亡。那么才5个人住院，1个人在 ICU。
Additionally, we have 3,155 people who have recovered from COVID-19.
Good. 3,155个人全部痊愈。
We have no new healthcare facility outbreaks. So that leaves us with 2 active outbreaks in our healthcare system,
目前还是2个
one
爆
long-term
发，
care facility
一个是
and
长
one
期护理院，
acute
一个
care
是
facility.
急诊性治疗所。
And there's no change in the number of people who have been affected in
因为那边还会有新增的案例爆发，按新增案例，所以还定义为爆发。所以这个也是长期护理院和一个没有新增社区。海龟的话，那个小镇也没有，都是好消息。所以，但是我们持续的在关注监测那边也是，如果大家有症状什么都必须要联系我们。
associated with the Fraser Valley Packers.
有59例啊，就是蓝莓采摘场现在已经59例了。
There are again, there are many people who are in who are contacts who are self-isolating, and we continue to monitor.
谢谢他们，很多人也是自我隔离，也是主动联系我们所以这个也是希望大家能够主动的采取措施。
There are no health concerns related to the consumption of fruit and vegetables.
那么这个也是根据这都是一些
confirmed to have COVID-19, and that is something that we are fairly confident of now, having
所以我们也有很有信心不要对食物产生过滤的焦虑这个很多看到了这个那请你们吃这个吃的食物之前呢那个洗清楚清洁干净所以这个也是上次说了，通过食物传染是很少的。那么现在大家可以看到 BCCDC 网页都可以去看看包括如何洗清洁这些食物等等蔬菜蔬果。那么过去几个礼拜大家都看到每天新增的案例有所增加这个也是我们过去所做的一切的反应。那么接下来呢也是因为过去因为不是有一个长周末吗？加拿大国庆日吗？等等这些都是反映了我们现在的数字。
outside of our household bubble getting together.
所以大家呢就是在 在室外的话，也不要太多的人群聚集，大家的这个社交圈不要扩大。所以呢，
We know that the potential for the virus to spread increases, and we've seen
所
the
以我们也
impact
看
of
到了
that.
这个
Thankfully,
病
we have
毒现
not
在在
had
内陆地
to
区也在
date
传，
much spillover into older people or into healthcare settings and other settings
所
where
以
we
不单
know
单的
the
是
risk
我
is
们
higher
符合
that
我
people are
们
going
这
to
个
have
卫生
severe
条例
disease or
的
to
环
die
境
from
在
this.
传播，其他的没有
However,
符合我们传
when
的
we
也都在
brought this
传
up
播。
and voiced our concerns to
所以
people
这
in
个我
British
们还是
Columbia,
要持续的关
we
注
now know that they
大
listen.
家必须
And
在
I would
我们
like to
BC
thank
省
people
都希望我们的
Thank you
这
for
个信
resetting
息
and
能够
rejoining our
听
efforts
到。那么
to
也
push
感
our
谢你们
COVID-19 curve down
对你们的
and
合
keep
作
it low and
共
slow
同的
in
参与
BC so that we can
抵抗这个
manage
病
this
毒，
outbreak
把这个
and
病毒疫
continue
情曲线
to
拉
open
低，
up our
以及
society to
如
have
何
those
帮助我
important
们
social
管理
connections
这
that we
些
need,
爆发的社
as well
区
as
使
to
得我们
increase
社
our
会
economic
整个社会
activities.
能够很重要的
I want
这
especially
个
to
同
thank
时
the
在
young
增加
people
社
who
会
have
经济
taken
活
this
动
to
的
heart.
同时
I
抗
know
击
it
病
is
毒
an
感谢大家的共同
anxiety-provoking
努力。
time. It has been a challenge
那
for
么
young
我也知道
people,
对年轻
whether it's
人来
teens
说
or people
大
in
家
their
都会
20s
有
and
焦虑
30s,
都
where
会
we
有
don't
各
know
种
how
各样
long
的
this
情
is going
绪
to last,
特别是对这些
where
20-30 岁
many
的
of
年轻
the
的人来
transitions
讲
and rituals that
这
we
个也
have
是
around
但是
graduation
现
and
在看
starting
到了
jobs
就
in
是这个
university
园
have
区
been
里边
really
传播了很多
rent asunder this summer.
那么包括了
And
这
I know
些
that
大学
people,
毕业生
particularly
啊
around
找
the
工作
Canada Day
啊
weekend,
等
really
等
had the need
那么
to
这
get
个
together,
夏
to
天
have that
包
joy
括
of
了
being
这个
together.
国庆节
And
的
that
长周
is
末
what we need to
等
do
等
for
大
the
家
rest
都
of
在
the
一
summer.
起
But we
欢
can
乐
do it
在
safely,
享受
and we
生
need to do
活
it
但是
safely,
我
and
们
we
还是
show
必
that
须
we
要
can.
始终记住安全
Many
第
things
一
may be different
我们
than
整个
what
夏
they
天都
were
要安
6
全
months
度
ago,
过
but let's not forget
所以我们千万
that
不要
rise
忘
across
记
BC. People have risen to the challenge, and
就
we've
是
done
说
an
我们
incredible
现在
job.
这个
So
在
let's
上
keep this
升
effort going
我
this
们现在
weekend
的这个
and
挑战
every
还要
weekend
不断的
this
进
summer.
行下去特别是这个礼拜长周末
We
这个
probably all know somebody
警
who
告
has
大
bent
家
the rules to make it work for them,
那么
and
我也
that's
知
not
道
a
大家
surprise.
都基本
I
上
think
都
until
按
it
照我
hits
们这个
home,
条
we
例
think
来
we are
走
immune to
按
many
照
of the effects
符合
of
规
things
定
like this virus. If you see them again,
如果你们
help them
看
get back on track.
如果
Help
看
them
到大
join
家有
the
一些
rest
不
of
端的
us.
行为请大
Remind
家
them
帮助
that
大
it
家
is
请
easy
你
and
们提醒
possible
他们
to have
能够
fun,
回来
to
能够
socialize,
走
and to
走到
socialize
我们的
safely.
正常轨道
To do this, let's keep our groups
所以这样的
small.
话呢能够
Let's
使
keep a
得
safe
那么同
distance
时
from
呢希
others
望
who
我们呢
aren't
能
in
够人
our
员少一点
small groups
接触
or
的
our
人少一
bubbles,
点大
no
家
matter
的
where they
他
may
说
be.
的这个
Although
社
we
交
may be
圈
physically distant,
社交
we
bubble
do
少一
need to
点
continue to have our strong
能够保持
social
社交距
connections.
离
And that is something that we have
那
been
么
able
他
to do
说
in
我
really
们现在
innovative
就是
ways across the
就算
province.
你有强
We
烈
saw
的
that
社
with
会
graduation
关
ceremonies.
系
We
网
see
络
that with
那
people
么希
getting
望也
together
是
to
能够
celebrate births, to
减轻一点
celebrate marriages. And I'm particularly impressed by the many young people and
所以我
teens
希
who have
望能
shown
够
how
把
to
这
do
些
this
信
and how
息
to do
带
this
给
well.
年轻的人希
Until
望
we
你们
have an
能够
effective
听
vaccine,
特别是
we all
20-40
need to
岁的
find
10几
that
岁的
balance
都希望
of
你们也
reducing our
是
risks
安全
and
前健健
increasing
康
our
康
social
除了
connectedness
我们有
across
效的
the
疫苗
province.
出来之前
It's not too
我们
difficult to do,
不能
but
做
it
任
does
何的
require
事情
all of
因为
us
我
to
们
be
这个
involved
风险没有
and
降
all
低
of our effort
所以这
all
个
of
也
the
是希
time.
望我们每一个人共
And
同
it is
参与
the
进
things
来
that we do
在任
that
何时候
protect
都要
our
共同
families,
努
our
力来保
communities,
护我
our
们的
seniors
家
and
人保
elders
护我们
we
自己
value
保护
so
我们的
much.
社区保护我们的长者
So we will get through this.
他们
This
都
is going
对
to
我们
be
是
our
太有价
COVID
值了
summer, an
所以我
unusual
们希
summer.
望能够
Some are
共同
doing
的
things
度过
differently.
那么
But
希望
we
今
know
年的
how to
夏
do
天
it.
和
And
往
we
常
will do
不
it
一样
together.
好不好
And this is how
跟
we
往常
can
不一样
play
的夏
safe
天
and stay
希望
safe.
我们做出不
Let's
同
make
的事
this
情过
long
来
weekend a different one
那
than
么
what
今
we
天
saw
的
in early
今年 年这一次的长周末也是不一样的策略，好不好？那么能够50%、25%、25%，它就是这个意思啊，就是分一些事情，不要和往年一样啊，这个来这个去，这个。那么这一次2位官员始终在讲了长周末的问题，我相信我们华人基本上还是自觉的，主要是不说了啊，其他主义。所以我们过去能够这么做的，我们已经能做了，我们能做了。他说，所以希望大家还继续这么做，还是3个著名的啊 ，be kind, be safe, be calm 啊。
Thank you very much, Dr. Henry.
那么也是说的，感谢这个伯尼医生。
Conscious and grateful that no one has passed away from COVID-19.
那么也是很感谢这个过去24小时没有人死亡啊，
We're also grateful that there were only 5 people in hospital with COVID-19, which I think is the lowest number since the middle of March, which is a significant
从3月份到现在已经显著的下降，就5个人住院。同时也感谢之前。
minus 144 from the height at the beginning of April.
那么我刚才没听清楚有多少个重症监护，我记得是一个重症监护还是2个重症监护？我们那么他也是说了这些5个住院的各个医院的分布那么也是说到了这个过去的2天里边大家访问急诊室的这个情况。那么也是希望就是因为我们最近的反复，就是因为我们的这个长周末都是这些的反应，大家放松的反应。那么接下来的这个 BC Day 的长周末呢，希望大家能够还是不一样，警惕在心希望我们能够限制自己的走亲访友的速度那么也是看到了，希望能够大家这样的话能够拉平曲线，能够。那么我们也是希望胜利，取得各种各样的胜利。那么我们第2阶段能够胜利走过，那么希望也是第3阶段、第4阶段都能这么走。因为阶段性的开放对我们的经济还是有正面作用。那么同时，那么这个也是教育了我们这个大家所做的一切的努力，在取决于这个我们现在的结果。这个也是希望大家能够遵守公卫系统制定的一些规则，能够我们在这个省。那么他也是说到了这个现在汇报一些全省的择期开刀的情况。那么他也是说到了5月7号以后的各些恢复情况，包括联系之前延误的病人。开刀病人，那么现在已经多少开了有些是非紧急性手术。那么他也是说到了6月份和7月份都已经回来了6000多个手术1星期平均。那么这个是在这个新冠疫情爆发的情况下还是能够完成的。那么现在呢，那么很多择期开刀平均排期15个月到22个月，那么现在呢已经大大的低于了之前预计的这个手术时间。那么现在呢，因为这个复杂的情况导致了我们额外的这个负担，所以呢现在呢礼拜6礼拜天都会了。那么大家都知道这个。那么他也是说到了整个夏天本来开刀的手术本来就不是本来就比平时少，那么现在因为之前的延误，所以呢都在积极的增加投入。所以也感谢了这个有一位网友说，听语说 BC 的做法堪称是全国的典范，我相当同意你看隔壁的阿省还有中国的马尼托巴省跟我们不能比了，更别说安省了。
46,606 were scheduled surgeries, and 13,957 were unscheduled or emergency surgeries. That's 11,253 in interior health.
我也希望每天听到的这个新增的数字都20几例再回到10几例这个也是大家共同的努力，所以2位官员说的也很义切诚恳也是说的言之灼灼，的确是这样。
Last week we reported 6,496 surgeries completed. As health authorities verify their data after the initial reporting cut off for our weekly report, we update the previous week's volumes and report the verified totals the following week. This means there were an additional 163 surgeries completed between July 13th and 19th, for a total that week of 6,659 surgeries performed. This week, we are reporting 6,379 surgeries have been completed. As well, the number of patients contacted about their surgeries continues to increase and now stands at 70,579. This is an increase of 3,891 from July 19th. I would note that in this process, almost 5,000 patients have been removed from the surgical wait list. 1,695
有多少
have for the moment asked to continue to postpone their surgery for COVID-19-related reasons. This is significant progress, and I again want to express my gratitude to everybody who's delivering on the surgical commitment. It is a true team effort. And as I noted, our progress will continue to count on each of us, everyone listening and everyone else in BC. The work each of us to stop the spread, made it safe to launch surgical renewal, and is key to the continued progress.
因为这也是关键，每个人的工作都是。
I also want to update on visits in long-term care.
那么现在也是汇报给大家，长期护理院恢复探亲的情况。那么6月30号开始宣布减轻这个限制措施以后呢，那么现在已经每一个长期护理院都有积极的落实安排探亲的计划。
In place.
所以已
This
经
week
有
I can report that 513
那么这个礼
facilities
拜
now
呢，已
have
经
safety
500
plans
多
in
个
place.
长期护
We
理
have
院
584 long-term care and
已经
assisted
完
living
成了
facilities,
这
so that's
个
an
探
increase
亲的
of
落
68
实
from last week's
584个了啊，这个已经
That means 88% of
已经
locations
相
now
当
have
于
safety plans in
88% 的
place.
长期护
I
理
think
院
it
已
is
经完
reasonable
成
to
了
ask, and
啊，
I
就
certainly
可以
have
有
asked
这
these
个计
questions
划了，你们可以
about the
去看
remaining
望老人了。
71. Disproportionately, they are assisted living facilities, which have a different circumstance and
因为他
and
说
standard
这
than
个有
long-term
些
care,
不是
where
很
people
等比
have
例的这
significantly more
进度，因
freedom
为
to
每
leave
个
the facility and
护
so
理
on,
院
and
长期
have
护理院的
throughout
具体
the
情况不一
pandemic.
样。
But I would also say this, that it's my expectation, and that expectation has been delivered to health authorities, that every single care home and assisted living home in BC will have a safety plan in place by next week.
所以他说我个人的愿望啊，他说我始终跟我们的卫生厅的官员也在说，就是我个人的愿望就是下个礼拜之前，所有的每一个的长期护理院都要完成探亲的落实，探访落实。
Our expectation that 100%. That I'll be reporting next week.
所以我是希望我们下个礼拜给大家汇报的时候，这个完成率是100%。那么大家记住啊，下星期四看看我们的 Andrew Dix 他说的是不是达到了。
Well, BC travel is a welcome break
那
from
么
the
也
local
是希望
places
大
we
家
know.
记住这
It
个
is
我
not
们
a
这个
holiday from the skills
我们
we've
现
been
在
taught to
BC 省
stop
没
the
有是
spread.
作为旅游
We
胜
must
地啊，
remember
你
to
们
pack
不要
our
来
COVID
啊，
sense
就是这个意
and
思，
to
不
use
要
our
大家
COVID
拥
sense,
挤
no matter
不要
where we
来
are in BC.
啊，包
And
括
right now,
停
whether
车
at home in our community,
但
or
不
as
要
we
大家
travel
拥
to
挤
someone
在这
else's,
些
we
景
need to be
点
even more
场
dedicated
所，
to the
包
actions
括
we've
一
taken
些
to stop the
小
spread.
偏远
No
的
matter
社
where our
区，
travels take
所以
us,
我们
with
希
BC
望
Day
大家
long
能够
weekend
还是
and through
安
the
全的
summer
度
and
过
into
这
the
个
fall.
长期
Physical
长假
distancing
期。
must always be our closest travel companion. Physical distancing
所以包括
saves
社交距
lives.
离
As
也
we
能够
celebrate
拯救生
BC,
命。
we know what BC stands for. We know it's British Columbia Day. It should also stand this weekend for Battle COVID Weekend. It should also stand for Break the Chain. It should also stand for Bend the Curve. That would be a
也是
BC
说到
Day
了啊，
weekend
这个
to
我们所做的
remember.
这一切都
Staying
是
100% all in
啊，刚才
in
说
our
的这
commitment
些
to
措
renew
施
the
啊
fight to stop the
啊，都是
spread
降低
will
疫
make
情
this
啊，
BC
拉
Day
低
long weekend
曲线的一个措
safe
施
and，fun
希望大
and
家又
memorable
安全
for
又
all
开
the
心
right reasons.
啊。
Aujourd'hui, nous annonçons
那么
29
我也
nouveaux
跟大
cas qui
家
ont été
讲一下，因
positifs
为
pour
很多网友不
COVID-19.
一定马
Un
上
total de
我们开始的时候他就来
3,591
收看我们的
cas
节
en
目
Colombie-Britannique.
那么我重复一下，
Il n'y a eu aucun nouveau
从
décès
昨天到今天的
lié au
24小时
COVID-19.
一共新增了
Un total de
29例
194 décès
那么现在
en
BC 省
Colombie-Britannique.
整个累计是 3591例，其中沿岸卫生局是应该1166例，那么那个飞沙卫生局是1066例啊，飞沙卫生局是1865例这个岛上卫生局是142例，内陆卫生局是360例，北部卫生局是84例。那么外面这个输入的，我们也就是外面输入的是61个，那么住院的是5个啊，零真死亡，这个很好，5个住院啊，就刚才 Andrew Dix 说了，这个显著下降。
You will not be audible until I call your name. First question is from Vaughn Palmer, Vancouver Sun.
Good day, Dr. Henry. When the restart program or plan was announced for the schools, you told us you have, quote, a great deal of confidence that this plan will be safe for the schools. Do you still stand by that station in spite of the objections that have been raised by the BC Teachers Federation?
那么也是说到了这个 BC 省的教师工会代表的这个表现的顾虑，你还坚持你觉得这个我们这个学校还会安全的开吗？他说我们始终做了承诺，我还是认为保证确保孩子们的需要，包括教育工作者的需要，包括整个教育系统的需要，是的，很安全。我们会有很多的细节出来，包括每个人的框架都会出来，这个是需要这个这样的话就对孩子们是安全的。这个是我们全体的目标。
Public health of working with our schools and working through all of the different things that we can be faced with, whether it's measles outbreaks or meningitis outbreaks, whether it's the pandemic of influenza we had or now COVID. And these are the important things that we have in place to keep everybody safe. And we know we can do that. We've looked at all of the other essential workers that we've had working over the past number of months, whether it's healthcare workers, whether it's our police services, our fire services. We have found ways to work safely, and I expect that will happen in the schools as well. And we've had a good practice run in June where we've learned a lot about what things can work and what things aren't going to work, and that's been what has helped us to develop this framework, as well as learning from other school settings from around the world.
从这个其他的学校的环境布置落实上看到了，学到了很多。所以请放心。
The number of flights that have been flagged because there were exposures on them continues to grow. I think more than 24 now we've seen disclosure.
他说到现在看到了已经有20多个地方报告了累计20多个地方报告了爆发的情况。 你看到了，如果有没有困难的去联系到他们，包括了航空公司提供的这个联系方式。
Have you gotten anywhere in getting the message through to the airlines that this is difficult, and why? Are you able to use the powers that you have as provincial health officer to compel them to make more details available so contact tracing can proceed?
航空公司要求顾客留下更多的详细联系方法。他说又对又不对。
systems work, the booking systems and the
他说我们现在很多航空公司要求的，比如说你在预订票的时候都留下很多的信息，这个都是在航空公司的系统里面，包括订票系统，包括灯牌系统。
line up and don't always provide us with useful information. So yes, we do get the flight manifests, but it often takes days to get them, and they may not have usable information that allows us to effectively contact an individual. So if somebody booked through one of the online booking systems or from a travel agent, what shows up on the flight manifest is the name, but not always how we can get in contact with them quickly. So that is something that we have expressed our concern about many times over many years, and we've expressed it recently to the Ministry of Transport again federally. It is an important piece that I believe is part of how we keep air travel safe, as we need to eventually open up air travel for business, for some essential travel, for moving people, and eventually, hopefully, we'll get to travel for pleasure again. It's something that I would absolutely be looking forward to. So those are some of the things that I think are really important. We were actively trying to find people early on in this pandemic, and it was a challenging thing. And this is not unique to BC, it's across the country. It's in many countries. And we were able to work with Canadian Border Service Agency, Citizenship Immigration, the Public Health Agency. You can tell how complex it is to try and match things like people's passport information to their names so that we could have more effective information. But again, that takes time, and it was done under the order that we had in place. When we put on a blanket quarantine order that anybody coming into the country had to quarantine, it became less important that we were able to identify people individually because we knew that everybody would be self-isolating. As we're moving into this next phase, it becomes, again, more important to be able to connect with people and ensure that those, particularly those who right around a person who is identified as having COVID, are aware of the risk. It is
我们
still
也
a
是知道
relatively
这个
low
能够
risk,
看到
but
风
it
险
is
在哪里。
definitely a risk that we would
就
prefer to
算
be
是
able
风
to
险很
notify
低
people
以
if we
后，
could do that
那么这
in an
还是有
efficient
风
way.
险，所以我们还是有
Next
希望能够
question is from
快速
Shannon
的
Patterson,
联系
CTV.
通知到个人。
Oh, hi. First for Minister Dix. Today, the federal government finally acted on the Alaska loophole. What's your response to that? And do you think more still needs to be done when it comes
那
to
么他
our
说问
land
的
and
是
air
这个
crossing?
今天联
I'm
邦
going
政
to
府
turn it to him,
的
but
阿
I
拉
will
斯
say
加的这个有一个
one
漏洞
thing, and
他说
I
问
think it's
Andrew
great.
Dix
I think that's a really helpful step, and it is something that that I'm thankful that has been put in place. I will also remind people
他
who
说也
have
是希望
traveled,
能
whether
够
you're
这
Canadians
个
who've
不
come
断的
back to
提醒大
BC
家，
from
就算你
traveling in
们
the
从这
U.S.
个
or
外面
anywhere
回来，
outside of
不管什
Canada,
么地方
that
回来，
you
就算
are,
是加拿
even
大
if
其他
you
地
are
方
an
回来，
essential worker,
都
you
是就算是
still
你
must obey our concerns around making sure that you obey the quarantine order and self-isolation. So a healthcare worker who has traveled to visit somebody who comes back must
所
self-isolate,
以不管是
whether
谁，
it's
只要
under the
从加拿
federal
大回
quarantine
来，回
order
到加
or
拿
the
大
provincial orders.
到我们
And
省来
I'm
都
saying
要
this quite
这
emphatically
个
today because it's become,
对，他就说
I've
这个
become
意思
aware of people who have
就要自我
traveled
隔
to
离，
the
自觉一
U.S.
点。
and are not, do not believe that they were subject to the requirements to self-isolate when they came back. And that is not correct. You are. The exemptions to the quarantine order mean, the federal quarantine order mean that you are allowed to come back into the country. It does not mean you are relieved from the obligation of
他说，就算
taking
是
the
你是
precautions
被
that we need so
认
that
可
you're
回
not
来加拿大，
exposing
不等于你
your
有这个
family
权
and your
利，你是
community
例外啊，
potentially.
不去检疫了，不受隔离了。
Well, I'm tempted to answer what Dr.
那么
Henry
现在
said,
就是
but,
这个
but
Andrew
I'll add to
Dix
that, that of
他
course we're
在
delighted
这
with the
个
federal government's take. That's
重复
the
一下，
step,
就是
but,
联邦
you'll
联
know
邦
that the
加拿
Premier
大
has
联
been
邦
a
政府
strong
的。
advocate for such action. He regularly communicates that directly to the Prime Minister, both in their bilateral discussions and at discussions amongst premiers and the Prime Minister, so we're pleased with that. What more can be done? I
那么他也
want
是
to
感谢这
join
个
Dr.
联邦
Henry
政
in
府的这个决定，因为这
delivering
个
the
阿拉
message,
斯加
particularly for
回来
people
是有一
traveling
个漏
within
洞
Canada.
啊，这个
It is
是。
not appropriate ever to get on a plane and travel sick right now.
那么
It's just
他也
not
是说到
appropriate
了啊，
ever.
这个是不规范的行为，就算你是生病了，你还要上飞机，这个是不好的，
manifests and so on.
不合适的。
That is an individual responsibility.
这
The
个是每
screening
一
on
个
at
人
the
自己的
airport,
责
we
任
hope
这是你的责任
that
啊，
the
这个
screening that
我觉
takes
得很
place
对。
on flights from, say, Toronto to Vancouver would also reinforce that.
那
But
么我们也是
practically
希望
speaking,
就
we
是
want to
加
deliver
强
that
从
message.
多
That
伦
is
多回
also
到
true
温哥
for
华
people
这样
who
的
visit
也
us
是要
by
有
car
这个
from
自
other
我隔离
provinces,
的
say
情况
from Alberta to, I don't know,
啊，包
Salmon
括
Arm,
阿伯塔
Kelowna,
到其
or
他的地方
Vancouver.
去
That
等等。
again, it is not appropriate in these times to
所以
travel
他也是
sick,
说的，
and it
如
is
果你
absolutely
是这
necessary
个
when you're
生病
visiting
了，
our
你还要旅
province,
行的
just
话，
as it
这
is
个
for
是不
British
对的，
Columbians
这
who
个
might
行为
visit
是不
other
对的。
provinces, to follow the rules that you ought to follow at home, but in any event, follow the rules we have in British Columbia. I think we obviously have to continue, as you would understand, to extend
所以他说，
limits
我
on
们所有
visits,
的这个
the current
这
limits
样的
to
措施和宣
essential
布，迟早会
workers
得到你
between Canada
的
and the
这个理
United
解
States. That I would hope that would continue to be extended, and that we would continue to make the case and to ensure that people traveling within Canada are aware of their responsibilities with respect to travel, because it's critically important for all of us, for every province. This is a world pandemic and it's a Canadian pandemic, and we have to act that way and act respectfully. And we, as British Columbians, of course, we expect to be gracious hosts, but we also expect people to come here to follow the rules and regulations of
所以也
British
希望
Columbia.
大家能够遵守这个法规
Do you have a
能
follow-up,
够
Shannon?
是自我隔离14
Yeah, for
天。
Dr. Henry, and I know you've spoken about this before, but with TransLink estimating less than half of people wearing masks, despite recommendations, and with back to school coming and other places like Toronto and Calgary making mask wearing on transit
那么也是说到了这个
why
口罩的
isn't
问题。
BC moving to mandatory
就
masks
算
on
是回到
transit?
学
Why
校
not
是
say
不是要戴口罩
it is
是强制的
mandatory even if it's not legally
包括你
enforced?
坐公
Because
共汽
that
车
would
是不
convince
是
some
被要求
people
戴
who
口
are on
罩
the fence to actually put that mask on.
Yeah, and that's an option that transit can do.
他说他这个也是选项啊，这个 transit 可自己去决定。
particularly good option. And
但我觉得这个是很好的选项。
We also know that other retailers and
包括了
stores
其他
have put
的
that
这
in
个
place
零
to
售
protect
店
their
都有这
employees
些
and
措
to
施
ensure, particularly if their
包
spaces
括了
are
他们
ones
的
where
雇
you can't
员
maintain
能
that
够确
distance,
保这
that
个大
that is a
家能
measure
够
that
有
they've
这
required
个
in
足
those
够的
settings.
社交距
And
离、
I
安全
would
距离
also say
这个
that
措
we need
施
to obey those, and that
我
I
希望
would
大家能
encourage
够遵守
everybody
这些
to
规
use
则。
masks in those settings where it's not always possible to maintain your safe distance.
Next question is from Richard Zussman, Global News.
Dr. Henry, we've been hearing, as I'm sure you have, a lot of feedback from people about the school plan announced yesterday. One of the scenarios that keeps coming up is this idea of parents with multiple kids in schools. Some cases there are teachers who live in the household, and so they're adding up the cohorts, 60 for one class, 60 for another, 120 for another. And in some cases, you now have what is in essence a cohort of 300. Are you concerned about these sort of circumstances? And what is your advice around before and after school care? And how should that
那么也是说到了啊，今天嘛，这个20例那边的23例啊，你就没有这个方面的顾虑啊，特别是那些孩子们啊 preschool after school 这些。
So when we're talking about
那么他说是的，这个都是一些基本的问题，但是呢，这个都不一样的啊，但是的确是有挑战，的确是有挑战。
Your sisters and brothers, it's about maintaining physical distance
那么这个是包
as
括了
much as you
大家
can,
这个
but
洗手
recognizing that there's
啊，
not
社
it's
交
not
距
always
离
possible in those situations, and that you want to have your potential exposure group to be much smaller than an
那么
entire
也是希望
school.
就是你
So for
的
most
这个社交的这个
schools, and
潜
we know the
在的
size
这
of
个圈
schools,
子越小
it'll
越
be
好。
one or two
这样的话
classrooms
呢
that'll be
整个
together.
学校
So it won't
能
be
够更多的
60, but the
这个
maximum is 60.
它是要求学校这个一个教室
older
最多
children,
是
we
60
know
个，
that
不要
they're
超过
able,
60
better
个。
able to maintain their distances, and we need to have a bit
那
more
么更加大
flexibility
的孩
in
子
the
们呢，
types
可
of
能
classes that they
他们
need
能
to
够
take to be
保
able
持
to
这个距
fulfill their
离
dreams and their
这个
needs
是
around
因为我们是
education.
希望能
So
够更多的
because
灵
they're
活性
able to
根据教室的
maintain
安
the
排
safe distances, to wear masks in appropriate times, to
那
maintain
么
the
也是
hand
希望能
hygiene
够
and other
很
important
多孩
things.
子能够
There's a little bit more
戴口
leeway
罩
in those people
那
that
么
you
可以戴口
maximum
罩
number of
能
people
够
that
在
you
适
might
当的
contact over
时
the
间里
period
边
of a
戴口
term
罩
or a year.
那么这个
So
呢
this is a way of
这个还有很
managing
多就是
what
限
could
制这
be
个
large numbers
人
of
数
kids that are
包括
intermixing
了
and
这个
mingling, similar to what we're seeing with social interactions, where you maintain your physical distance, but your contact group is much smaller than it might be
那么他也是说
if
到
you
了，这
had
个
200
就
or
像这
300
个我们
people
大
at a
人的
party.
社交一
So
样
it is
就是
consistent
你
with that
社交的
concept
人
of
数
how
少
we're
一
doing
点
this, and it
大
will
家社
look a
交的
little bit
时候
different in
距离
different
保持的
schools
话
and with
那
different
么
age
这样的一
groups.
个概念
But
是一
it
样
doesn't
的
negate the
在
physical
从不同的学校
distancing.
做法
If
不
what
一样
it
但
says
是
is
观
we
念是
know
一样
that
的
we can't always maintain physical distance
那
at
么
all
有时
times
候
in
我们不
schools.
能
So
始
we're
终
going to
保
make
持这
sure
个社交距
that
离的
the
话，那
risk
么我们要确
periods
保
are small and only with a small number of
那么
groups,
就是
a
人数
small
越少
number
越
of,
好
of other
因为你
students,
不能确
so
保
that
这
we're
个安
not
全距离的话，
potentially
那么这个
exposing many,
人
many
数就要
others in
少。
different areas of the school. So that's the concept
所
behind
以
it.
这个就
It
是
will,
这个我们的理念而已
it takes a while to figure
这
that
个可能
through.
是需要
And
一
yes,
些
it
时间
means
大家
that
去
for
消化
certain families, that'll mean different children will
因为
have
这个
different
都是
contact
意味
groups.
着每一个家
But we
庭
also
不
have
同
to
的孩子
balance the
但是
risks
我们一
that
定
we
要
are
平
trying to
衡
minimize
这
in those
个包
settings
括这
with the
个
very real
风险
risks
以
that
及
we
我
know
们最小
that
的这
children are
个风
experiencing
险
now
让它
from
最
being
低，
out
同时
of
又要开展
in-classroom
活动
settings.
这个呢
And
都是
that is
一个平衡的
something
问
that
题
we
包括
haven't
我们
maybe
教室
not
的
paid
设
enough
置啊
attention to,
等等等
whether
等
it's mental health issues,
包括因为
whether
孩子
it's
们还有
food
这个
security
什么
issues,
包
whether
括
it's ability
食物
to
安全问题啊心理健康问
have a
题啊
safe home to go home
等
to.
等
There are many different needs
所以很多
over
人
and
不
above
同
the
不
educational
同的
needs that
需要
children
需
have,
求都不
where
一样
in-classroom
所以
settings are
包括
incredibly
了教室
important.
里边
So
的设
it
置
will
啊
be working things out,
所以我们已
and
经
each
都尽
individual
力
family
的
will
根
have
据
to
不
work
同
it
的
out
环境设置
based
来
on their
做
own situation.
所以
And that's something that we've known from the very beginning of this, that it affects different people differently. In terms of aftercare, again, those are things that we're going to have to look at. And every family will have to make some decisions for themselves. And some of that will be who else is in the household bubble, the people that you do have consistent close contact with, and how do you minimize the interactions for people who might be at risk. So that might mean that there aren't certain after-school activities that are with another group of people. So those are things that we will work out, and every individual school and school district is looking at those things now.
Do you have a follow-up, Richard?
包括每一个学校校区都会有一些不同的安排，所以家庭们自己去决定。所以他说，这个记者说，很多家长也担心把孩子们再送到回去，而且有风险，他们家长有顾虑。你看看。
Who decide they're not comfortable with the plan, and we're hearing in some cases that it's vulnerable kids, immunocompromised kids, those that are worried about underlying health conditions that won't go, and advocates are saying that if they miss half a year, a full year of school, they'll never be able to catch up.
Absolutely, and that's why we have this plan in place. There are options. We're not saying that every child has to be in there. That is not what the plan says.
他也是说，我们不需要，不是说每一个孩子都要去学校我们的目标是能够支持孩子们都能够到学校教室里边去读书，去学习。
And we know that there's access to online and other forms of education. But those are questions for the Ministry of Education. The details of those.
我们都会，大家都可以在网上，大家可以去获得很多的信息，包括我们的教育部。我会告诉你们很多我们现在所有的焦虑之前都没有，就像这个病毒之前都没有过一样。所以我们现在就是要做的就是能够如何取得平衡。他也知道这个让孩子们学习，又让孩子们能够有一些社交，能够在情感上。能够保持乐观，这样的话，学校里边的学习，同时呢，又让他们能有限的社交，包括与教育工作者的这个交流。
But does have effect on older people.
所以这个对我们每一个人来讲都是很大的冲击。所以我们一定要找到一个方法。
We're doing it in long-term care.
所以我们你看到了，我们现在在这个长期护理院，我们做了什么？我们现在看到了很多这个让这个很多基础工作者一直没有停止在工作，他们的基础服务等等，我们的社区我们的便利店等等，这些我们的社区设定等等，这个是对我们来讲都是至关重要的，都包括孩子们的学习，所以我们一定要就是看到一个平衡点。这个我们需要花很多的时间去考虑各种各样的选项。那么昨天呢，我也想说。
There is no such thing as no risk.
他说世界上没有一个地方是没有风险的。这都有风险，包括这个其他很多不知名的病毒包括流感病毒
So these are things that we can deal with, and we've always had immunocompromised teachers. We've had immunocompromised children. That we've accommodated in our school system, and we will be doing that again to make sure that we're doing everything we can to protect people, but recognizing that we have many risks in our community and our homes right now as well. And what we all need to do in BC, and have been doing really well, is keeping our community transmission low, because that protects us all and allows us to make sure that our children are getting what they need.
那么也是让孩子们有所需要，我们能够给他们。
Hi, Minister Dick. I was just wondering, are you still planning to reinstate the waiting period for MSP and also to end temporary coverage for
那么这个是卫生厅长的 MSP 因为这个6个外国劳工。
Thanks for the question, Lindsay. So we made a series of changes around April 1st. With respect to the medical services plan to make it easier in a time when, one, it was very difficult to get other forms of insurance. There was challenges with the federal government renewing permits and other changes. So what have we done and what will happen? And those changes were made for a temporary basis until July 31st, 2020. So what we're doing now for people in the following categories, if you have expired temporary worker study permits, and this was in response to some of the concerns that we heard from people, you may be provided temporary MSP coverage if you're currently living in BC, of course, you've applied for a new permit, implied status, you were previously enrolled in MSP as a deemed resident, and your MSP coverage has expired. In those cases, people need to contact Health Insurance BC to request this temporary coverage, and this temporary coverage will be valid until October 31st to allow and ensure people can deal with the federal government and possible delays there. So we made that change to assist that group of workers. With respect to the wait period for MSP, so I just wanted to put that in context because I think it's an important issue. On or around April 1st, we made the change to not have the wait period because of all of the difficulties people remember what the circumstances were like at that time. We have what's called a 90-day rule, which means that, say you're working in California or you're working somewhere in Canada and you return to British Columbia, for the first 90 days, you have to provide your own health coverage, and then you applied MSP at maximum 90 days, which is say 2 months plus the remainder of the month in which you apply. You have to provide your own medical health coverage. What this does is allows us to ensure that the public health care system that we have is able to provide services for people in British Columbia. So we have a 90-day rule, which means people cannot just come here and on the first day get health care and get that health care
看到了每天给大家汇报的时候，每一次汇报的时候都说有多少人住院，这个是很重要的指标。所以今天卫生厅长说，大家看到了吗？今天只有5个人住院，就是说这个已经大幅度下降了。那么这样的话呢，我们的医疗资源就不会被击垮。那么这样的话，就死人就会比较少，是这个意思。因为从这个纽约啊、西班牙、意大利啊看出来死亡为什么多。主要是医疗资源被击垮。那么，美国总统川普一直说，呼吸机是很难造的，但是美国已经很多地方很多厂，比如说通用汽车厂啊什么，都在积极的应战都是1星期全国有生产数千台这个呼吸机。它的目的就是告诉大家，就是美国的医疗资源还充足，所以呢，死亡的人数比例不高。
Do you have a follow-up, Lindsay?
Yeah, and just with regard to the foreign workers with permits less than 6 months,
那么这个还是记者问的是外国劳工的许可6个月的问题。
In fact, that category of worker, we had very, very little uptake on that change to allow that coverage to exist for temporary foreign workers under 6 months. So that's something we'll continue to review, but the reason that's coming to an end is the same reason as the other things, that it was difficult for some people to ensure appropriate coverage in that period, in the April 1st period. It's clear to us as a result of the evidence over the last number of months that people do in fact have coverage. There was very little take-up of that. So we're just going back to what it was prior to April 1st in that case.
Next question is from Rob Buffum, CTV Vancouver Island.
Oh, I think this question is probably from Minister Dix, and it relates to
今天问这个卫生厅长的问题比较多一点。
who have a loved one at a care home
他说我今天
in Duncan,
跟2
and they're
个长期
frustrated
护
because a
理
month
院
ago
的
the
人，
government
他们
announced
都觉
that
得比
visits
较
will be starting soon, and they've yet to be able to see their loved
沮
one.
丧，就因为1个
In
月
both
之前
cases,
政府就
the
宣布
men
允
have
许
dementia and are
去
declining
探亲
quickly.
访友，去探访。
I spoke to the care home who said
那么现在很多
attributed the
他
delay
说的这2
the
个
fact
家
they haven't
庭
got
都
funding
比
from
较
the
沮丧，
government
因
yet
为
to
还不
hire
能去
more
看。
staff to make it safe. So I
那
guess
么
I'm
他也
wondering
是
what's
说
your
到了
message
这
to
个
the
政府
families,
能
but
不
more
能
importantly,
雇佣
what's your
更多的
message to
资
the care
源
home?
去保护
It's our
老年人。
expectation that people will
他说
provide
很遗憾听到你说的这个消息，这个我们当然会提供更多的这个安全的措施。那么政府呢也会考虑到 BC 整个BC 就是那个国庆节的时候的长周末的这个措施所以呢很多卫生管理方面呢
100% of care homes and assisted living homes will have safety plans in place by next Thursday, and that's the circumstance. So and I want to say that I think that there has been extraordinary work by care homes and by health authorities, and to allow our visitation policy to go forward. And of course, many care homes, often they have weekly visits. People have had 3 visits already or more at certain care homes in BC. And so that it's possible and that the plan we put forward is prudent is demonstrated by the fact that currently we have, for example, only 1 outbreak at a care home in BC. It's a serious one, and it's at Holy Family. So the reason we have started slow with visits, with 1 designated visitor per resident in a care home is for this very reason, because we wanted to ensure that it would be easy for people to apply the rules. It's our expectation. It's our expectation in the coming months to have more visits and more possibility of visits and consultation with obviously care providers and others. So we've committed enormously to the process. Care homes receive the retroactive period from April 1st to June 30th, $26.5 million across the sector in support. We're providing more money as we look forward to building out our visitation policy. That number is $160 million, which is a very significant amount of money. There have been $165 million made available to put in place the single site provision. So all of those are significant changes, and it's our hope and expectation that the modest start allows care homes to act, and in any event, it will be our expectation to see those policies next week. And I think care homes, all of them, are doing their absolute best, and I think everyone needs to understand as well that the 1 designated visitor per resident, that was a decision that we've made at a provincial level. So there's some people who are expressing their concerns, the care homes, about that limit. And the reason we put those limits at a provincial level is the same reason we've taken all the other steps we have. We're going to be methodical, we're going to start slow, and we're going to get it right.
Rob, do you have a follow-up?
I just wanted to clarify, in this instance, I gather from the care home, and from Island Health for that matter, they have submitted a plan, a safety plan that has been approved. So do I understand when you say that you expect by next week 100% of the care homes in the province to have safety plans, in place?
保证下个礼拜100%全省所有的长期护理院都能够重开，允许大家去探访。
I'd expect, given and all of this work has been done together with National Health Association, obviously with health authorities and BC care providers. But I would expect that people should be receiving visits. Obviously, it's not the visits that everybody wants.
但是呢，不是所有的人都希望有人去看，可能有些孤独老人什么的。那么有些人呢又希望经常去探访，每个人的要求不一样。所以很多计划已经落实了。那么现在呢，就是1个老人有1个指定的探访的人，这个已经是可以做的。这个已经看到了这个。
Obviously, working with all of the people in the sector, we hope to expand that out in a safe way in the coming months. But we have to do it slowly and the money, well, it's I've described to you the very significant resources that have been put in place to support this. I'm very proud and pleased of the involvement of the Hospital Employees Union, the BC Government Employees Union, the BC Care Providers, and Denominational Health. So it's my expectation, yes, that people should be getting visits, and will be people wish to contact the Ministry of Health around these questions. We can work through the issues and move on.
We have time for one more question. For any reporters that didn't get to ask a question this afternoon, there will be a statement released shortly. For recommendations on protecting families and communities and for access to provincial guidance on COVID-19, visit bccdc.ca. And for non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. Last question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry and Health Minister Dix. I'm not sure who can best answer this. I'm hoping it's Dr. Henry, but do you have any confirmed cases linked in British Columbia to someone that was actually exposed to COVID-19 on a flight 他说你有没有这个确诊的案例在 BC 省有一个确诊的，就是说是确定的，一定是在飞机上得到的这个，有没有这个案例告诉我们？那么你也。
Not an easy question to answer.
他说这个问题不好回答。我们看到了很多人在这个1月份以后，就看到很多人在飞行期间这个看到了从中国来啊，中国伊朗来啊，都是从美国来啊。
There have been people who have been sick.
这些人都生病了都在飞机上这个爆发过所以现在很难说这些人传在飞机上传给了哪些人。但是这个肯定很低的风险，但是只有这个风险那么因为环境不一样那么有些人旅行的地方不一样有些人是在这个的确是在飞机上得到的，有些人是
So we've had people who've arrived ill and who've developed illness.
他说我们是看到了很多人发生了不同的病状或者不同的国家来
circulating COVID, and they've all been on a plane together. They may have been next to somebody who was ill, may have developed illness once they arrived here, but it's hard to know if they brought it with them from the country of origin or whether it was acquired on the airplane.
那么你就不知道这个他在飞机上是不是传给别人我觉得这个伯尼医生回答的是很对，的确我们这个外行的人根本就这个病毒是在飞机上传的，不知道。伯尼医生说了，那很多就是你不知道他是上飞机之前就获得的呢，还是在飞机上传感染的呢？他说，但是他说了一句，风险有，但是很低这因为你根本不知道，说实话。
Heading down to Third Beach tomorrow night for a party that is or is not sanctioned.
Well, I know it's not sanctioned, and I
他说这个不是禁令，就是明天很多人可能是50个人的聚会不能超过。那么明天像这种天气肯定在海滩上很多人那么包括很多的公园包括我们的沿岸卫生局等等都有这个加强了卫生官员的警察的这个监督这个是希望他们能够整个全省都能够执行加强这个大家这个对这个命令的这个执行，包括我们还要对这个度假屋包括其他的地方包括邻省的地方包括我们本地的市政府的官员CNP 警察等等，还有我们的很多执法部門，这2天都会加强执法，看看大家这个遵守卫生禁令的情况。那么希望大家能够少部分人每一群人距离远一点，那么大家能够欣赏音乐，欣赏这个夏天，享受音乐，享受这个夏天。
Thanks, Marcella. At the risk of channeling the Premier, I think people do need to give their head a shake a little bit here. But the things that we're most concerned about, the things we've seen in other places, which are indoor parties, which are less likely, although I understand some places have air conditioning, less likely in this period. But on this hot weekend, but indoor, close parties, if people are being invited to those parties, but they don't know people who are there, and they're joining in those things. I would just say to them, this is not我
是警告大家现在不是时候这个礼拜周末下个礼拜周末都不是这个所以希望大家特别是这个室内的 party 少开一点，特别是这个长周末
Look at those kind of events and not go. And if there are events where everybody's invited, of course somebody at the event needs to take the responsibility for potential contact-tracing purposes of identifying and writing down everyone who's at the event. So I think this weekend we can do this. We can absolutely do this. And it's not just a question of someone putting up a poster, whether it's permitted. We all have the responsibility, it seems to me, to look at that situation, to understand we're in a pandemic, to look around at the people we know and love, and to make the right decision. Thank you very much, merci.
我们现在所处的形势，我相信大家都会有一个正确的选择我觉得卫生厅长说的这些话很有道理。那么今天的这个新冠疫情的转播呢情况介绍呢就到这儿。
那么基本上呢，我再给大家做一个简单的数字汇报。昨天到现在一共是新增29例，有一个好处是没有死亡，这个是很好的。那么那个现在住院呢是5个，其中重症监护的是2个。好，那么这个礼拜已经没有了，请大家明天准时关注我们的温哥华港湾网站 bcbay.com 或者是我们的温哥华港湾的微信公众号，我们都会及时的告诉大家最新的疫情的增加数字。那么下星期2、下星期4还有2次的新闻简报，请大家注意收看。